This is a collaborative event between IPPO Cities, part of the International Public Policy Observatory, which is a observatory of societal responses to COVID-19, funded by the Economic and Social Research Council, and our city strand is supported by our friends at Bloomberg Philanthropies. The Centre for Homelessness Impact supports the use of data and evidence to bring about a sustainable end to homelessness. We distributed in advance of this event a joint report from CHI and IPPO on homelessness and the pandemic, emergency measures during COVID, what worked in global cities, which forms the kind of background material for this session. I do recommend you all have a look at that report if you've not done so already. There's lots of great stuff in there. This session will take a two-part format. We're going to begin with three presentations, one from the UK, one from the US, also looking at other places in the world, and one looking at initiatives by cities in Europe. And we will then have a little bit of Q&A and then switch to a panel discussion chaired by our chair, which is Professor Sir Jeff Morgan, who is the co-investigator of IPPO, with other panelists to discuss. We have set slots of about 90 minutes, but we won't go over that. And without further ado, I would ask one more thing before I hand over to Jeff, and that is that you can keep your microphones switched off when you're not speaking to allow no kind of rustle and ambient noise in the background. That would be great. But Jeff, I'll hand it over to you to introduce our first speaker. Thank you.
Well, thank you. And thank you all for joining us on what is a rather cold and miserable day here in the UK, but hopefully better elsewhere. This is the second event we've done between IPPO and CHI, taking stock of what's happening, what's working, what could be done in the future around homelessness. And we've got a fantastic group of speakers to talk to us this afternoon, and also I'm aware we've got an audience very, very rich in experience and knowledge about the field. So I'm keen that we involve as many of you as possible in this, so please do use the chat function for comments, for links, for questions, disagreements, whatever it may be, and we will have some time for dialogue as well. As Jeremy said, this study published today is full of, I think, really interesting case studies from Birmingham to Budapest and many other places on what cities have been doing. And this, in some ways, remarkable pattern of relative success and action and alacrity in using the crisis to deal with issues which perhaps should have been dealt with anyway. It certainly has prompted a degree of urgency and energy in public policy, which perhaps wasn't there before. And I guess our key question for today is both sort of what do we learn from that, what worked, but also what might be done in the future. How can we take forward those successes? We held quite a big event last week as IPPO, looking more broadly at the pandemic, almost exactly 2 years after the first lockdowns, and a lot of quite complicated issues in terms of scarring effects, problems, lessons, and so on. In some ways, perhaps the issues we'll be dealing with this afternoon are more straightforward, but perhaps not. We'll see. So our first speaker is Eugene Rourke from Emmaus. In fact, by coincidence, quite irrelevant to this discussion, I'm actually sitting on an Emmaus chair at an Emmaus table. But anyway, Eugene, would you speak to us first? And unmute yourself, yeah.
Hi, thank you, Jeff. First of all, I'd like to say thank you to you guys at the Centre for Homelessness Impact for inviting me to speak with you and attend this today. I've got 5 minutes, and I'm not sure how much we can cover in 5 minutes. I feel like I've got 5 hours of content at least to share with you, so we'll see what we can do with 5 minutes. I do also tend to speak quite quickly, so if people at the end can ask questions when the opportunity arises, please do note anything down if you've missed anything that I've said. I just want to cover a few angles briefly. I want to reflect on my experience as a professional working with homeless people or people who have experienced homelessness for the last 20 to 25 years and across the sector, but also as an individual who's experienced homelessness myself, street homelessness and other problems. I reside in Wales, in Cardiff, and I've worked in Wales all of my life. The challenges have been massive through the whole of the pandemic. A lot of stuff I can say that I understand everybody will have experienced as a public and you know, society has experienced some crisis. Some of the challenges in terms of trying to provide for people experiencing homelessness during this time have been ranged across having to deal with the individual stresses people face, the individual trauma people are experiencing, and uncertainty. Certainly people experiencing homelessness often are familiar with uncertainty, perhaps more than others, but massive levels of uncertainty across the piece and real major concerns people's mental health, and I'll touch on that a little bit in a moment. One thing we have seen, has been great to see, the governments have managed to take people off the street largely. Not everybody, but largely, and this has happened. We've seen evidence of this, and we've seen that this can happen. So I'm encouraged to see that that can happen, and obviously asking the same questions as to why this hasn't happened before, showing that we do actually have the means, if need be, to make this happen and kind of address homelessness largely under the pandemic. When I was homeless myself, if this had happened then, I would have perhaps been housed quicker, which would have been a positive, certainly. I understand the DWP has also been a little bit more lenient for a lot of people in terms of their requirements to attend meetings and other stuff, and the demands, which can be an additional stress for people who are experiencing homelessness. However, for people who I know who are still homeless and people I've worked with that are homeless, sounds like big issue vendors have had difficulties, people having to interact with people. I know street buskers, I know the arts and entertainers, people who are homeless and use that space to try to generate some capital and some money, and that's been difficult for them, obviously, due to the lockdown experience. Some of the major professional challenges, again, touching back on, anxiety levels have been significant. Services, to be honest, in my experience, have pulled together very well. And I think we've worked collaboratively, perhaps stronger than we have done in other circumstances. People have really kind of put things together with the resources available. We've been fortunate to have more resources thrown at us, as we are often done in the first light of a big problem. And I'm concerned whether them resources will still exist, continuing and going forward, if as we deal with this crisis. And I expect there will probably be more lockdowns. I'm not sure where we are with that, but that's my opinion. Some of the difficulties that we had initially, so for example, we struggled to find basic necessities like hand sanitizer, things we just kind of generally use in our practices. The University of South Wales and some others in South Wales put their means together and developed the hand sanitizer, which was great. So again, some local organisations, academic and otherwise, frontline services coming together and making things happen. It was really difficult trying to shop for 17 people in a Mayors community when people shout at you in the supermarkets about what you can have and what you can't have, and there's no special food doesn't drop from the sky for services. So some of them battles have been difficult, and hopefully we can build better bridges going forward. We relied strongly on a lot of donations, and luckily a lot of businesses that weren't able to operate gave us some food and supplies, and we made the most of that. Again, some of the main concerns for us, though, really has been around mental health for people. A few days ago, I attended the funeral of a 30-year-old man who took his own life because he struggled with isolation, and he had to isolate due to the circumstances of COVID. It was difficult. I've known another 2 people in the last year that have taken their own lives, one certainly to do with the COVID and the pandemic, and not thinking it was ever going to end, and the restrictions on their life. It's a real thing. But just to conclude, I think going forward, some of our concerns is the whole pandemic is going to result in more homelessness, I think. Increased mental health problems, issues with addiction, issues with trauma, issues with bereavement. Services are massively under stress. The health services, they're an amazing, courageous job, as did all workers across the piece. But invariably, there's more stress on everybody. And I think everybody is shattered and battered. And we really got to think about the quality of services and the support people need to deliver services going forward. Again, will it be the same amount of money around second time and third time around? I doubt it. I'm not sure, but we still need money. And I'd like to just finalise in the point that it's been great efforts to make pop-up accommodation of all kind of sorts and kind of adapt to circumstances on the ground, and that's been great. I think the private sector needs to be more involved in that. It's interesting that we can pay for temporary services that cost a fortune. And private rented sector accommodation probably doesn't cost a fortune. So perhaps if we could use private rented sector accommodation next time around and accommodate people, perhaps they can stay in there. Perhaps they could have accommodation as a result of it. Perhaps we can use our resources for the better. It's always difficult to use resources proactively, particularly in the time of crisis. But I think we need to be kind of proactive in thinking about ending homelessness across the piece and using resources wisely and using the efforts that we've got left to the collective better of everybody. I hope that made sense in all of 6 minutes. Welcome questions and any clarity to be asked later on down the line. So thank you for your time.
Brilliant. Thank you very much, Eugene. That's a really great start to our session. I think many of the issues you've raised will come up in the discussion, and perhaps particularly how we cope with the squeeze on cash, which is going to be hitting governments all over the world, the squeeze on cash hitting households, an economic shock which may be increasing lots of the stress which drives homelessness and making some of the solutions harder. Our second speaker is Roseanne Haggerty. I'm really glad you could join us, Roseanne. I've known Roseanne for many years, admired her work, not just across the US, but also in other countries like Australia. And we're really interested to hear your perspective on what's been learnt and what happens next. So Roseanne, please put your camera on and speak to us.
Okay. I hope, I think my camera's on now. Good.
Perfect.
Jeff, thank you for the welcome, and thank you for including me in this important conversation as you launch this very important report. As Jeff mentioned, I am based in the US and lead an organization called Community Solutions that works nationally with communities toward a lasting end to homelessness that leaves no one behind. And it's early yet, I have to say, to know the full impact of our federal responses to COVID here in the US on levels of homelessness. Frankly, as a country, we don't have the data to tell us whether what we've been investing in is working. The most current national estimate of those experiencing homelessness, which showed an 8% decrease from the previous year, is based on a one-night count that's conducted annually in the country. And this was, again, most recently, the data reported was from January 2021. So the data we're going by is old, and it's an estimate at best. In fact, that estimate did not include the unsheltered homeless, who for the last several years have been the fastest growing group of those experiencing homelessness in the country. So you see the dilemma. We have, as a country, invested over $10 billion, which is terrific, and directly into homeless services in this period of time, in addition to what had been the kind of standard levels of support. But we have not had the data in place to really look at the impacts. But I actually want to call that out and do so at the beginning here, because I think the need for timely, comprehensive public health quality data on homelessness and who's experiencing it in real time to guide interventions and to tell us whether our investments are working and to assess impact on reductions is one of the key lessons that we've learned during COVID, the need for quality data, quality real-time data. Fortunately, I think some of the insights that we have drawn from communities with good data can be an important contribution here, because reliable data does exist in the communities that are part of the Built for Zero movement. This is a nationwide effort involving 98 communities, regions, making up about 70 million people. So about a quarter of our national population have their community is involved in this effort that is taking this rigorous public health informed approach to moving toward a standard, basically an equilibrium measure drawn from public health called functional zero homelessness, where homelessness is measurably rare, quickly flagged when new housing crises occur, and sustainably and quickly resolved. And so I'm going to be speaking from our insights based on the data from these communities. And I can really highlight 5 important learnings that have emerged that really track the experiences of those communities that have been keeping very good data. First, the need, and this is very consistent, I think, with what you found in the report. First, the need to establish an urgent, shared, measurable goal for reducing homelessness at the population level. That has to remain with us as an outcome. That's been powerful in communities that have stepped up, and especially those who have very intentionally created, number 2, a command center type emergency management structure for unifying and adapting responses to homelessness as conditions change. And as all of the phenomena during COVID have been, I think, a lesson in adaptability for every sector, but it has proven to be a critical mechanism, that kind of collaborative structure for making progress in reducing homelessness. Also, we found, number 3, the need for a feedback loop with person-specific, real-time information accounting for all of those experiencing homelessness across the community. Think of it as a public health registry tracking homelessness. Fourth, This is something I think we have all seen the power of finally having sufficient levels of flexible resources to match with the needs of those experiencing homelessness. And last, we've seen the power of having communities with ready access to a menu of tested practices. So they're not having to innovate to completely on the fly, but can ground their interventions as their data suggests what has to happen next in some tested strategies. And so to provide a little bit more context, the goal of functional zero has, even during the pandemic, when communities and staff working on homelessness have been so stressed, has proved to be a very resilient measure of basically a community getting to an end state where you're measurably keeping ahead of homelessness, preventing most of it, flagging it quickly, resolving it swiftly and appropriately. We have now 14 communities that have reached that measure for one or more subpopulations, typically veterans or those experiencing chronic homelessness. And we have another 44 communities that are steadily reducing homelessness for one or more subpopulations. And at the outset of the pandemic, by way of a little bit more context and to tell you more about where these lessons are emerging from, there were 79 communities who were involved in Built for Zero at the beginning of 2020. And despite all of the demands, 34 of these communities did not miss a beat and reported their monthly data to us throughout the pandemic. And so based on that fairly large sample, 20 of them actually continued reducing homelessness over the course of the pandemic and have continued to hold those gains following even the end of our national eviction moratorium that happened at the end of August last year. And we can also see in the data that communities that struggle to keep up with reporting, but we have still been in close touch with and working with, or saw increases, that our system improvement coaches working with those communities saw many bright spots that are consistent with the 5 key learnings I touched on. And to say a bit more about them, on the urgent need to provide basically a shared message, a sense of urgency, a clear measure of success, the urgent need to provide safe accommodation, we saw shifted the behavior of government and not-for-profit actors. Past concerns with eligibility criteria and rigid processes were replaced with a clear goal and flexibility. We saw innovations emerge, such as, for instance, in Montgomery County, Maryland, they created very quickly a grant program to move individuals who are experiencing homelessness for the first time directly into apartments, just basically an individual grant, like a guaranteed, a payment, and it was amazingly successful. But that was a resource that they didn't have access to before. Again, helped them quickly move a whole cohort of people out of the shelters and directly into apartments, not even into hotels. Second, with respect to the importance of a governance structure, like a command center, what we saw is communities who were coordinating their COVID relief in such a structure really recognized homelessness in some cases for the first time as a public health emergency. New relationships were formed in this kind of deep, active, collaborative space that it often involved public health officials engaging with groups working on homelessness, again, sometimes for the first time. And the focus we saw a shift from a concern with individual program outcomes to developing community-wide strategies that were nimble, that could quickly shift to protect those experiencing homelessness from COVID, get them into safer accommodations, out of congregate shelters, off the streets, and continue to reduce homelessness. We saw how communities could very quickly help people move indoors and out of these vulnerable situations with that level of disciplined collaboration that was sort of a manifestation of the silo busting that we all know needs to happen. Then the third point about the role of data. Communities that had comprehensive current information on those experiencing homelessness, we saw places like Hartford, Connecticut, were able to move with incredible speed to find and move into hotels individuals who were experiencing homelessness using the first wave of federal funding we had, that was emergency management funding. And then they very quickly slotted in the next wave of federal support to help move people immediately into permanent housing from those hotels without missing a beat. We could also see in so many communities that the data is what made those command center relationships really tick. People were looking at the same information, they're trusting it, they're making decisions jointly based on that. And next, about the sufficient and flexible funds. I think for the first time in many of our working lives, we saw the resources were in place to match the level of need, and could be much more both deliberate and fast in matching people to what they would need to move into a safer accommodation and then on into permanent supportive housing or some other situation. We saw and continue to see real innovation again using these funds. The state of California, as I think was noted in the report, itself took the lead on creating a purchase program that has acquired at least 6,000 units within vacant hotels and pledged them into permanent use as supportive housing for the homeless. And we see this happening in many other communities. In fact, we're working with 16 of our Built for Zero communities similarly to acquire property to hold for the long term and help sustain an end to homelessness. And then lastly, before closing, I'll just observe that we saw communities making gains and reducing homelessness through the pandemic. We're often drawing on proven strategies that they were learning from other Built for Zero communities, and that the benefit of that network, I think, was really demonstrated, that communities weren't having to reinvent the wheel. They could quickly see what their data was saying about what was working, what was needed next to move people into hotels off the street, get resources to people, attract new staff, all of these problems that had to be encountered. They were drawing on the lessons and the proven strategies that they saw other communities using. So again, very pleased to be part of this conversation and look forward to learning with you.
Thank you so much, Roseanne. You packed a huge amount into that short talk, and I'm sure we'll pursue further those issues, and particularly the data ones. Certainly in the UK, some fields had a remarkable pandemic in terms of quality of data and speed of data. Others were really shown up. This issue about flexibility of resources, often easier in a crisis, harder when sort of normal bureaucratic processes return. And in a sense, core to CHI's remit is having that menu of experiences, models, proven approaches to draw on so everyone isn't improvising. We'll come back to all of those later. First, we'll hear from Marie McClelland from Urbact Roof Network. And for those of you who don't know Urbact, I think Urbact is one of those sort of slightly below the radar sort of remarkable institutions sharing very practical experience on all sorts of issues involving cities. Very practical, very low in hot air. So Marie, to you.
So can everyone see that okay? And can everyone...
Yeah, we can. Yeah, thanks.
Okay. Perfect. Okay, good afternoon, everyone. I'll buck the trend and share a screen. It's purely so you don't have to look at me speaking or see my children running about in the background while I do this. So good afternoon, and thank you for asking me to speak today. My name is Marie McClelland and I work for Glasgow City Council, but today I'm here on behalf of the Roof Network. Roof is a network of 9 European cities funded by the Urbact programme, which is an EU programme that helps cities collaborate to solve some of their biggest social and economic challenges. The focus of Roof is to find innovative ways to end homelessness, especially through housing first, through better use of data and storytelling, and also to look at prevention ecosystems. The network of cities is diverse. It is led by the city of Ghent and includes Poznan, Timisoara, Liège, Thessaloniki, Odense, Braga, Toulouse and Glasgow. Now, Roof began at the beginning of 2020 and we had barely started when the pandemic hit. A lot of the work that we had planned was therefore sidelined. So the nature of the project meant that when the practitioners involved from the cities were now dealing with crisis management. So this was a major shift for the project that was supposed to be focusing on innovation, collaboration, problem solving, and ultimately learning from each other. We also had to change how we worked and move online, as everyone did at that time. But what the pandemic did was it presented us with some unpredictable and interesting learning. all of the cities would agree that their responses to homelessness gave them opportunities that they would not have previously had. They had to find very quickly solutions to end street homelessness and prevent the spread of infection, and the responses were varied. For example, Ghent and Glasgow utilised hotels to make space for those who were roofless, which we've heard from in the United States also. Other cities like Poznan used housing units or units that they had not used before to house homelessness. But ultimately it provided cities with the opportunity to do things in a new way. What the pandemic showed was that despite what we think about municipalities and municipal structures, communities themselves can be very agile, very adaptable, and very responsive in times of crisis. Many cities provided not just housing support, but welfare support through the provision of food and fuel, access to medicines, hygiene, checks on the vulnerable, for example. Thessaloniki and Braga, for example, integrated health, social and housing support, sometimes for the first time, to provide a more holistic response to the crisis. The key learning from the cities is that agility and adaptability are possible. We can do things in a very different way, and while some of the solutions were in no way permanent, the cities did now have time to think and appreciate that long-term user-centred solutions could be found. What the pandemic also did, however, was shine a light on the cracks in the system. Odense, for example, highlight this in their learning. They explained that the challenge was more centred on the way systems and organisations speak to each other and connect, rather than on homeless people themselves, and this is an opportunity to correct that. But significantly, there was also learning in cities about the perception of homelessness and homeless people. Toulouse reported that there was a shift in how people perceived homelessness, because it was clear that there was a greater risk now to everyone, and people could now become homeless very, very quickly. In Liège and Timisoara, both learned that communities are key, and working more closely with communities and actually with people make solutions that are much more fit for purpose. Overall, there are some key points that Ruth would like to share as their significant learning, which is probably the same experience in many cities around the world. The cities that already implemented housing first had a lesser challenge, as they had already tackled street homelessness to a certain extent, and they could move more swiftly to tackle what street homelessness they still had. The community around us is a very, very valuable resource. This includes the homeless community, and they should be central to how we design out homelessness. We must work together and collaborate. If we could find the ways to do this during the pandemic, then we can continue to do it beyond the pandemic. We also recognise that there are different types of homelessness, and not just those who are roofless. The pandemic forced us to look at all types of homelessness and also the causes. Many people who were vulnerable or just coping before were now beginning to face homelessness as a real and present threat, and that's now also the case with the cost of living crisis. We must rethink how we do things for the common good and work together to provide a more structural solutions to ending homelessness. The Roof partners would like to share that if the pandemic taught us anything, it taught us that we can have more imagination around these than we think. So thank you very much for listening.
Thank you very much, Marie, for those points and the issues you raise. How do we get longer term working across the silos? What's happening to perceptions of homelessness and risk and so on are really key ones. We've got about 5 minutes before we need to move into the next group that we will come back to all of you. And I'd encourage everyone on this session to throw in comments or questions or issues you think we need to address in the next hour or so. I'd just like to throw one question at the three of you to get us going. And it's a question which could be answered at great length, but try not to. As Eugene said at the beginning, we may be entering a period of more stress again. We sort of feel we're coming out of the pandemic, but we've got the Ukraine war driving millions of refugees right across Europe. We've got the cost of living crisis putting an extraordinary squeeze on households. In that context, Have you got any thoughts about how we maintain the public will and the political will to continue acting even as these other crises mount, and to maintain a sense of urgency and action? Eugene, would you like to maybe just give us a thought or two on that, and then I'll go around each of you.
I think points have been raised by my colleagues there as well, that resources are stressed, and we've been quite innovative in responding to stuff, and sometimes I think high pressure can bring the best out of people in terms of what we have to offer and be able to create and be creative. I'm just concerned really about the strain on people, the strain on individuals and resources, because it's been really tiring, and I think that across the whole workforce, everybody that contributes intellectually, academically, professionally, practically to homelessness, the cost of wear and tear on people is a real concern. So I think we need to kind of invest in looking after people as much as possible and equipping people to go forward with the continued stress, because the number of people that I think that are going to be kind of more vulnerable to becoming homelessness as a result of the circumstances is large. So I think we just need to invest in looking at people as best as possible.
Thanks. And Roseanne, what's your thoughts on this?
Well, I think we've seen that accountability has been maybe a key missing ingredient. Whose job is it in any community to end homelessness? And the learning from this collaborative approach, frankly, that is often found in effective public health systems, that you just need to think in terms of the whole. I would hate to see that get dismantled. We find ourselves saying, like, whatever you're doing to contain COVID, keep that going to stay ahead of homelessness. These habits we've learned about collaboration and working back from a goal. We've all had exposure to how important it is to have that kind of clear and organized and coordinated intent. We've felt it when it hasn't been there. We've seen when it's worked. I think also in a world where our interdependencies have just become revealed to us anew, almost in novel ways by the month. At least in the United States, I hear more conversations happening than ever before about housing as a system. Like, why is our zoning the way it is? Why are our financing rules and our occupancy rules and our distribution of resources rules the way they are? And that these are questions that are coming up not just with respect to homelessness, but an awareness of we do not have communities built in the way that will enable them to sustain shocks. And so I think just leaning into the need for collaboration, for honest conversation about the root causes of problems and our interdependencies is one way we can just be honest in facing the many challenges of the time.
Thank you. And Marie, in your context in Glasgow, is the answer to one of Roseanne's questions sort of clear in terms of who owns the problem, who is at least at the core of the collaborative network with a responsibility for fixing homelessness? Is that the city council, or is it unclear?
That's open for discussion. I think the city council definitely has a role. And you have to forgive me, I'm an economist, I'm not a housing expert, but one of the things that we are looking at in Scotland is a public duty to prevent homelessness. So in a lot of the conversations we've had with housing and homelessness experts, not just in Glasgow, but across Europe, is if we make the prevention ecosystem stronger, then it takes pressure off the system further down the line. And that means that Housing First and other measures work more effectively for the people who actually need it. So one of the biggest challenges we have just now is that just coping group. So it's the group of people who with if there is one shock to the system, whether it be economic or social, they will be tipped over the edge into homelessness. And it's how do we provide a system of support? Now we're looking at developing a new community wealth building strategy for the city, which is not just, it's almost looking at a more well-being economy approach, trying to shift the kind of economic strategic direction from just about being jobs and businesses to actually looking at a more holistic local well-being economy that can prevent homelessness happening further down the line. And we're doing a lot of work in the city to try and establish what learning we can get from the local organisations who are working in this field. What are the trigger points? What is it that they are seeing at the moment? So yeah, I think there is this kind of structural homelessness, but there's also the just coping group, the people who potentially could be coming online very soon because of all the challenges, Jeff, that you mentioned earlier.
Well, look, thanks Marie, thanks Eugene and Roseanne for getting us going in such a strong way, covering so much ground, so many issues. There's some great questions in the chat, which I hope we might pick up in the next round, our next set of speakers. Questions about what actually is happening to the facts, as it were, on the ground. What do we know about things like hidden patterns, sofa surfing, etc., and also what, if anything, is happening to public willingness to act either directly or indirectly. So thank you all. We're now going to turn to our next group of speakers, and to kick us off, Lygia from CHI, who've been very, very active throughout the pandemic in documenting what is happening, looking at evidence, promoting evidence-based solutions. So Lygia, over to you, please.
Thank you so much, Jeff. It seems to me that one of the most unexpected things about the period we're living through is how homelessness is emerging as a rare good news story of the pandemic. Not many of us would have believed it possible 2 years ago. So today I thought I'd use this opportunity to talk about 4 reasons to be optimistic about what comes next. First, coronavirus has brought us together. Many people and organizations from outside the sector stepped up to help and are continuing to do so. We are also seeing more and better collaboration between the health and homelessness sectors, and our annual public attitude survey with Ipsos shows that the public really care about homelessness and are pro-helping people and taking action. Second, governments at both local and national levels across the UK and elsewhere took swift action, and policy commitment remained strong. In England, in the autumn, the first ever 3-year Rush Sleepers initiative was announced, and a new version of the government strategy is due to be published this summer. Scotland, Wales and Northern Ireland, in the meantime, have pledged to end all types of homelessness and to transition towards a rapid rehousing system. The COVID-19 pandemic also highlighted the importance of local action, and clearly cities across the UK and the globe will continue to play a key role in building healthier, more inclusive, just and equal opportunities for all. Third, we've seen a new appreciation for data and evidence. The coronavirus pandemic highlighted the fact that existing data is not adequate to respond to a situation like this. Real-time quality data is indispensable for guiding strategy and coordinating multiple interconnected interventions. We also need clear definitions of what ending homelessness actually means, which is why we are pleased to be working with the government and a group of early adopters on a set of indicators that will allow us to track progress and set better success measures at both national and local levels. We are also finding that there is a growing appetite for figuring out what works, for whom and what doesn't, using experiments with rigorous measurement of both the costs and the results. And this is a significant development also. And finally, there is a growing awareness that if we are to end homelessness for good, we need to build better systems as well as better lifeboats, including for those with no recourse to public funds. To prevent homelessness at population level requires complicated system-wide solutions. We need to acknowledge that even our better services or performance management systems can never be more than lifeboats. We also know that to stop the flow of people into homelessness, we need to address the larger housing affordability and accessibility issues and ensure welfare and healthcare support and wages are adequate. By reallocating resources towards prevention, our approach to addressing homelessness will be both humane and more effective. So to recap, we are now at the decisive point. There is a historic opportunity we cannot miss. And the deciding factor will not only be funding available, but also making sure that we're using it effectively and with the right type of mindset. Thank you.
Thank you very much, Lygia, and we will go a bit later into exactly what that might mean, those challenges around data, experiments, etc., etc. Our next speaker is Linda Gibbs, who's now with Bloomberg Associates, advising cities all over the world, but was in a slightly previous life deputy mayor in New York, so someone with very direct experience of how you get big complex systems to work on difficult issues like poverty or housing. So it'd be really good to hear from you, Linda, about how, from your perspective, is this a surprising success story of the pandemic, what's been done all over the world, including in the US, on homelessness, and how do we use that energy, that momentum, that relative success for the next 5 or 10 years in what may be a difficult climate? Linda.
Yeah, thank you, Jeff, for that, and for the invitation to join all these amazing speakers here today. It's really a pleasure. I was also, before I became the deputy mayor, I was also the commissioner of our homeless agency in New York City. And so had 4 years of hands-on experience in managing a very, very large, very bureaucratic system. And I'm in the camp of the pandemic had like massive silver linings for the homeless services field. We saw just tremendous innovation. People, I think the urgency of the moment, the understanding, as Roseanne shared, I think is a great insight, that the understanding of homelessness as a public health issue in a more clear way because of the pandemic, and both the need to give shelter for public health reasons, that are the urgent public health reasons, rather than the kind of chronic issues that we're very familiar with, that don't get the same kind of urgent response at large. And also, people get out during an emergency. I've through a number of really big emergencies, and during emergencies, like, it brings out just the best of people. Like, they get out of their bureaucratic silos. They find ways to work around rules that, had always been inviolable in the past, and suddenly we're unimportant. The urgency of dealing with the best outcome for individuals in need just kind of prevails, and people, they take the initiative to do the right thing, even though there might be a long list of regulations that say you can't do it. People just figure it out, and systems work together to change rules in real time. Like, one of the best examples we had here in New York is we have a central intake center where everybody going into the single adult shelter has to appear personally in order to access a bed. We closed the subways down during the pandemic because, it's a 24/7 system, and that pushed a lot of people who were essentially taking shelter in the subway out. And this, hundreds of people, not 10 or 20, hundreds. And that caused a on the spot, on the subway platform solution of like, well, let's meet them and greet them and escort them to shelter and escort them to intake. And people didn't want to be escorted to 30th Street in Manhattan for intake. And so the agency and the outreach workers on the spot devised a virtual intake process, and were able to take people to the closest shelter or hotel accommodation that popped up. So that kind of like changed the rules. Innovation happened. And I won't repeat, there's so many great lessons shared, and I want to just shift over and sort of think, like, what is it going to take to move this kind of innovation culture forward? What is it going to take to make these collaborative partnerships for problem solving the norm and not the exception? And I'm worried about two big things. First is the exhaustion of the workforce. Frontline, the workers, the outreach workers, the shelter workers, all of the service coordinators. These folks have been throughout the pandemic, continuing to go to work, meeting with clients, doing the frontline work, doing it more than usual, acting in the extreme, putting themselves at risk to serve the clients under emergency situation that has been a chronic emergency. This, people can do this for a couple of weeks or a month, but this kind of, they are just exhausted. And as we all, take a nap and get our energy going for thinking about how we're going to sustain all this great learnings moving forward. People are just exhausted, and I'm really worried about whether both the frontline workforce, but also our managers are themselves mentally and physically in a place that they can do that. And then the second thing that I do worry about, and we see this already, people are retreating back into their silos. And it's really, this is a moment that we have to take those newfound partnerships and collaborations that occurred in order to problem solve during the pandemic, and hold on to those and make them the norm by creating a governing structures that sort of acknowledge here's how we band-aid and paper clipped something together for the emergency. It had all these great benefits. We need to routinize those structures, and they become the really valuable place for sharing that data, keeping ourselves refreshed, and sharing, being a place of innovation and sharing innovation. The last thing I want to point out that I think has become obvious from the that we've heard so far is the power of multi-city networks for sharing best practice and supporting each other, like a cities of peer support. I think we saw that in the Roof Partners example that we just heard. Roseanne has been doing that with her Built for Zero communities. In my case at Bloomberg Associates, we had been working with about a dozen cities at the time that the pandemic hit. We just held weekly, and actually I was going to say monthly, but they wanted more. In the middle of the management of the crisis, they wanted more frequent meetings because they were learning just problem solving, right? How did you get those hotels open? Who did you talk to? What were the rates that you were paying? We had cities paying wildly different rates, and coaching each other about, how you have those conversations and what are the terms and conditions, and just tremendous in the moment problem solving that these kind of peer networks created during the course of the pandemic. And, to me, I was like, we got to free up their calendars. This meeting is too frequent. And they're like, no. I wait till Thursday of every week. So, because I got so many questions I got to answer. So, it was that I think is another learning and the benefit of these nice network organizations that have developed in order to support our city's work.
Thank you so much, Linda. And yeah, I think it's one of the great stories of the last 2 years is the extraordinary role played by so many of these horizontal peer networks, people creating almost mini clubs of mutual support, real-time learning, often not with very formal institutional structures, but playing an absolutely crucial role as people are coping with huge stress. And I should say, one of the other things we're doing at IPPO at the moment is quite a big project and study on stress for the frontline health and care workers who had 2 years without much respite. And there's a lot of evidence on the levels of stress and mental illness and and burnout. And we're trying to look at what are the lessons, what's the evidence on how you address that quite in these very large scale organizations. And maybe that's one for another day. And another slightly related topic is the extraordinary pattern of the pandemic. I think in the US, it turned out that half the lowest paid jobs in the US are deemed essential, which is a much higher percentage than the highest paid jobs. And it's the same here. We've seen a complete inversion of which roles turn out to be really valuable, and that's not the ones which are valued in pay terms. Anyway, that's perhaps for another day. Our third speaker in this group is Stephen Aldridge, who's been right at the heart of the sort of the national policy response. And as indeed many other things relating to leveling up, useful analysis, data, policy experiments, and so on. So Stephen, it'd be really good to hear from you. You ready?
let me unmute.
Can we see you even?
Yeah,
perfect.
Got it.
Yeah, right.
Sorry. Look, fantastic. Can I just to start? I just wanted to say I thought the paper that was published was really, really good. So well done to Tim Gray and everyone involved with that, and great contributions today. I mean, like others, I think a great deal was achieved during the pandemic. Maybe we surprised ourselves. The Everyone In program was remarkably successful at getting people off the streets, helping people at risk of homelessness or in unsuitable accommodation, getting them into hotels. But maybe it's just worth noting that as well as that, there were other things that happened. I don't think anyone's mentioned yet the temporary evictions ban in the private rented sector, for example, or the extra funding that was made available to help people with rent arrears, for example, during the COVID crisis. I'll return to that point in a moment. Others have also highlighted the substantial improvements in partnership working between different agencies, how things became more flexible. Of course, big question whether that will be maintained. The impacts of these various things were indeed quite dramatic. So comparing numbers sleeping rough in the annual count in 2020 with the pre-pandemic period, there was a fall from 4,270 to 2,690, and then it fell further to 2,440 in 2021. That's the annual count towards the end of the year. We also, as a department, collect sort of monthly management information, which was recently published for the first time, and that showed that in February 2021, the number sleeping rough fell to 1,360. So quite remarkable numbers. And similarly, if you look at our homelessness statistics, the number of households owed a prevention duty in 2021 compared with the year before fell 20%, and the number of households with children threatened with homelessness fell 29%. I think that's a lot to do with the evictions ban in the private rented sector, and it may be that one of the longer term consequences of that is that, as people may be aware, the government's planning to proceed with an end to no fault evictions in the private rented sector, and there'll be, I think, a white paper on that a bit later in the year. So what lessons? Well, doesn't this show that we can tackle homelessness and at speed? We can get different agencies to work together. We can also change practice. So, for example, institutional discharge practices changed during the pandemic. But as Roseanne and Linda and others have said, will everyone revert to the status quo ante after the event? But maybe the biggest impact of all these measures was the impact on people's health outcomes. So, one study showed that together they had reduced number of infections by over 21,000, hospital admissions by just under 1,200, and saved the lives of nearly 270 people. It's quite remarkable. So what are the challenges we now face? Well, as you've said, Jeff, will there remain the political and popular will to maintain the progress that's been made, especially as other new challenges come to the fore, whether it's the cost of living crisis or focus on global events such as things happening in Ukraine? Will everyone's attention be elsewhere? I think what I want to draw out is that there are some sort of key practical issues to remain focused on, which have been mentioned, but I just want to go through them perhaps a bit more systematically. One is we need to be clear what we mean by ending rough sleeping. So we need to be clear about our goals. And I think the work that Ligia mentioned and that the centre is doing is really important here. Clarity about functional zero or what international best practice we want to emulate is really important. Second thing is being focused on what a well-designed and well-structured strategy looks like. What we're trying to do in this country is put in place a cross-cutting strategy for cross-government strategy for tackling rough sleeping, and one that has a number of particular strands. So a prevention strand, which a lot of people have emphasised, an intervention strand, you know, where for whatever reason, you know, our prevention policies fail, we then need to be able to intervene, and then we need to be able to help people recover for the longer term. So you need all of those for a successful strategy, and actually all of them can offer value for money. I'll return to that point in a moment. Third, as many people have said, we need good data and evidence. Actually, my view is that we've made a lot of progress improving our data and evidence base in recent years, and a lot of that does predate the pandemic, though none of this means that we don't have a lot more to do. We certainly have better homelessness data than we used to. What's known as HCLIC, our case level information collection, gives us case level information on people who approach local authorities for help with their housing, and we've ambitious plans to link that with other administrative data. We've sought to improve our evidence base on the characteristics of the street homelessness. Just before the pandemic, we had to, because of the pandemic, had to stop this, but we recently published something called the Rough Sleepers Evaluation Questionnaire, which tells us a lot more about the characteristics of rough sleepers and the services they use. And one of the things that showed, and this is very relevant to something that Marie was talking about, it shows that the cost to public services of not helping rough sleepers is quite substantial. So the demands they make on public services is 3 or 4 times that of the population as a whole on average. We've also thoroughly reviewed the drivers of homelessness and street homelessness, and over the years, though again there is more to do, we have done quite a bit of work to improve our evaluation of both preventative measures and treatment, and those generally show that the interventions we have offer good value for money. So, you know, in terms of persuading policymakers or the public, it may be that the fact that these things stack up, they offer good value for money, they offer social benefits, maybe the case is there. In terms of areas where we need to do more in terms of data and evidence, I think we need to do more to understand stocks and flows. So one of the things that puzzled a lot of people was that under everyone in, we helped nearly 40,000 people by the end of 2021, and they were puzzled about how that related to an annual count of 2,500. It's a stocks and flows point, and we need to understand that better. We would love to do better stock and flow modelling, but we've not been able to do so. We'd like to do much more evaluation at the system level rather than individual programs, and we'd like to understand better the impacts of some other departments' interventions, links again to the system level work. And then the last thing, and I must stop, is you know, if we want to be successful, if we want to continue success, we need the resources to continue. Maybe there'll never be enough resources, but the department feels it had a pretty good spending review settlement, £2 billion in this area for the next 3 years, and that will be used across those areas of prevention, intervention and recovery to seek to make further progress in tackling street homelessness and indeed homelessness more generally. So a few things there to reflect on, I'm sure, but happy to take questions.
Thank you very much, Stephen. That's again a fantastically comprehensive and clear picture. We've now got about 25, 30 minutes to ask any questions of the individual speakers, to raise issues. For those people already spoken, and perhaps all put your cameras on if you can, to please suggest what you would like to answer to. And I might just pick up on what Stephen said and suggest perhaps there was a threefold framework, which in the past I've found quite useful for thinking about rough sleeping. On the one hand, there's the flows into homelessness. And as Stephen said, handling of eviction has been one important part of that. The discharge arrangements from prisons or mental health or all sorts of other institutions, exactly how they do it is really important. Sometimes works quite well, sometimes falls apart. There's then the support for people when they are homeless in terms of provision of accommodation, provision of support, which may be quite complex, personalized support for multiple needs. And there we need the data, we need the real-time partnerships. And in the past, there have been big pooled budgets for that, and other times it's broken back into silos. And then the routes into new homes, new relationships, new jobs, etc., which is a vital part of this story as well. So we can really cover anything anyone wants to raise. Could we maybe have 1 minute on this just definitional point? This is the nerdy academic in me. I mean, are we clear about what the definition of functional zero or what the target is? Is that something we need to worry about? Are we almost there? I don't know, Lydia, do you want to comment on that?
Very, very happy to, Jeff. That's part of the work that we're currently doing, because at the moment, whether you're in Scotland, Wales, Northern Ireland, and you have a government commitment to ending homelessness, or whether you're in England and the commitment is ending rough sleeping, it's not entirely clear whether absolute zero is meant or not. The same applies to local areas with similar commitments. So part of the work that we've been doing alongside local area partners and the different governments is precisely ask those questions and essentially helping people scope different options. As a centre, we don't think it's realistic that certain parts of the country should aim for absolute zero. So for instance, Westminster is a good example. We know from behavioural science that targets should be challenging but realistic as well, and it's really setting people up to fail if you provide a set and unrealistic target. We also know that the public agrees with the idea that absolute zero may not always be the evidence-based way of setting targets in local areas as well. So
Lucy, look how much straw you're bringing out.
Could someone could Simon Chilcott mute perhaps?
So I'll leave it there, but happy to go into more detail. Essentially, it's work in progress, but it's part of one of the things that we feel very positive about what's happening currently is that there's this willingness to be a lot more transparent and actually pin down these very difficult questions.
Yeah, and Roseanne, do you have a comment on this? The definition of success? Mm-hmm. Is this straightforward? Does it have to vary by area?
I don't think it needs to vary by area. And in fact, Jeff, I think one of the things that we're working on and beginning to meet with federal partners here is a definition of functional zero for all, not simply subpopulations. Mm-hmm. And some of the criteria we think are important really do go to this translatability. Is the definition objective and replicable, standardized but dynamic to local conditions, simple and usable, and credible with critical stakeholders, including people with lived experience and practitioners in the field and the public. And so those criteria, one could imagine, could be met in any context.
Yeah, and you've got different targets for different groups like veterans, is that right?
Yeah. We do, and I think though there is a sense in the field here that we should move more toward whole populations, like single adults, families, and not be as focused on individual subpopulations. We've learned a great deal about what works and how to organize at that level. But I think based on this learning, the next chapter of our work and that of the communities we're working with really will be to all single, zero for all.
Thanks. And Linda, can I turn to you on this question of throwing out rule books, or which bit of rule books to throw out, or is it okay to throw some out temporarily? But I mean, all big systems, all big bureaucracies need some rules. Everyone would love to live without them completely. How do you think we should think about what is an appropriate, an optimum degree of flexibility in the next phase of action on this?
Yeah, and it's interesting because I think the answer probably does also differ by differing populations. But for me, if you think about people who are on the street or who are at risk of being soon without a home and on the street, there you want the maximum flexibility. And one of the I think we saw a lot of movement across jurisdictions for low threshold options, more harm reduction approaches, less rule oriented standards for shelter accommodation, so that less discharge for violations, much more. So not only were they kind of better offers in terms of private hotel rooms, but there was also, you don't have to commit to sobriety, and just a lot more movement of best practice in the field toward those low threshold, a greater array of low threshold options. But also, it's like, this is a different, I want to talk about the mental health issues and how we might think about that going forward. But there's examples of, like, I just went to a supervised injection site that's just opened in New York City. And the worker there had to explain how they had a kid who was addicted and wanted to go into treatment. And they literally had to have him chug like 3 beers in order to demonstrate for the intake test that he had 2 presenting problems, not just addiction. They're like, I can't believe we're doing this to you, but we got to get you drunk and then take you over and get tested, because that's the only way we can get you admitted. I mean, how inhumane is that, right? And rules do exist for a reason, and I've been an enforcer of rules, for a lot of my government career, so I don't think that rule free is what we need to do. But when we find those really stupid things that are the results, I think people have to feel more permission to just break the rules and then, advocate, for solutions, instead of taking, because sometimes moving these through bureaucracy can be brutal. But also flexible funding is really, really critical. The people with no recourse to what do you have? I forget your phrase, the people who don't have the eligibility status for services. And this is the connection back to the understanding the public health risks and costs of not providing them services. So by not providing service, you're actually increasing the costs of emergency services. So beyond, if you don't want to consider it in terms of human need, look at it in terms of community impact and long-term fiscal impact. It's irrational not to provide them services, because they're going to show up in many other ways in much worse conditions, seeking out and services and using resources. So the funding flexibility is also really critical. And since I'm on a roll, and then I'll say the last thing, I think that there's an opportunity ahead of us to what Eugene started us off with is his fear and expectation that we're going to see a huge increase in homelessness, because, or you didn't say huge, you expected an increase because of all of this trauma that is there across the community. And one of the largest contributors to homelessness, including for those who find themselves on the street, is family discord. And a lot of that family discord comes from undiagnosed, untreated mental health conditions. And so if we can find ways to partner with the behavioral health community and think about the preventive support that individuals and communities should receive, that could be a great way to prevent. Somebody's endorsing, jump in.
So Stephen is nodding furiously. Yeah.
Yes. Yeah, totally agree. Totally agree. I mean, may I?
Yeah.
I mean, this is something my team, we've come across in other contexts, not just in relation to homelessness or homeless people. If you're concerned with families that are struggling more generally, very often the absence of the right sort of mental health services exacerbates those problems. And the work that we've done has shown that, if you can provide them with the right support, you can make a big difference. Just wanted to say too, very much agree with these points around the rule book. I mean, as Jeff says, of course, we have to have rules, but sometimes it's good for them to face a shock. The sad thing is it takes a crisis like a pandemic or a war to do that. But I noted, for example, one of the things that I used to read before the pandemic was that it took drug companies 10 years to get a new drug or vaccine approved. We did it in a year during the pandemic. I and my team before the pandemic faced enormous problems in accessing and linking administrative data. It's amazing how many of those barriers were broken, reduced during the pandemic period. Now, of course, I perfectly understand people's ethical concerns when I and researchers want to access data and use it for research purposes, but really, I wonder whether we miss the benefits from making better use of the data that we've got. So I think being willing to challenge rule books is important, and more importantly, where we've done rigorous evaluations, we've shown using the sort of linked administrative data, for example, we've been able to show that if the interventions that we're concerned about work, a good value for money, and make a real difference to people's lives. So it's in a way, it's a tragedy that it took a pandemic to change some of these things.
Yeah. I mean, just on the rules, and I helped draft the Rough Sleepers strategy 20 years ago when we set the completely arbitrary goal of cutting the numbers by 2/3 in 2 years. It was done. And key to that was actually getting rid of almost all the rules, creating holistic teams with holistic budgets whose only task was to achieve the outcome and really to have as few restraints. And that actually worked pretty well for quite a long time. It required quite a bit of money, of course. And at the time, we thought there'd be much more progress in the kind of approaches to budgeting, both Stephen and Linda, you mentioned, where you would look in a much more rounded way at how different things interconnected. One of my big disappointments the last 10 or 20 years is how little progress anywhere in the world has been made on really thinking in a systems way about money. But that's perhaps one for another day. Can we turn to the data questions, which quite a few of you raised? A lot of progress on data and measurement. There are the concerns of all the restrictions on sharing administrative data. There's the question about the very personal data. How's that being governed? How's that being guarded to alleviate concerns? Where do you think we could be in, let's say, 3 or 4 years in a really mature sort of data system for homelessness? Roseanne, with some answers.
Well, this is an issue that has been figured out in the healthcare sector. And so I think a lot of the learning about data protections, data privacy in the United States, it's called HIPAA, the legislation that guides compliance with private information and how it can be exchanged within necessary groups, that this is a problem that's been solved in other spaces. And so we are really building on that. And not to minimize the importance of having protected data, but I do find that often that's just, we've convinced ourselves that this is not a solvable problem, and yet in these adjacent spaces, we have found mechanisms. And so I think we should challenge ourselves to be looking at what are the data standards, this technology required to support them, giving people more control over their own data who are experiencing homelessness or risks of homelessness. But these are problems that have been solved in other spaces, and we should not think that we need to spend years debating this in homelessness in order to make progress and be accountable for results for people.
Eugene or Marie, would either of you like to comment on this in terms of your experience? What would actually be helpful to you in terms of data, or are there concerns you have about perhaps it being abused or lost or hacked or whatever? I mean, there's a whole series of risks around data, or is that a non-issue?
I think from our perspective, I think what's really critical about data is not so much, we've had lots of conversations about this across the cities and roof about having comparable data around homelessness. And I think our challenge is it's not necessarily about comparable data, it's about what you do with the data that you have. So I think it was mentioned, I think it might have been Linda or Roseanne, about real-time live data that can be, you know, that feedback loop. And it's how do you use that data? We're often in situations where we're saying, we need more data, we need more data. But we don't actually stop and say, well, why do we need this data? And what are we actually going to do with it once we've got it? And we don't have the resources to use that data to implement change. So I think, you know, as I said before, I'm not a housing or a homelessness expert, but my experience has been a lot around working, you know, in the economy. And we've got lots of really insightful and unique data around child poverty at the moment, which we know is a driver for homelessness. You know, you're more likely to experience homelessness as an adult if you experience poverty as a child. And we now in our city have, for the first time, data that shows to the household the level of poverty that household is currently experiencing. But it's about what we do with that data. How do we use that data to prevent future triggers for homelessness or for unemployment or for, you know, mental health? So for us, it's not just having data, it's about being creative about how you use data in the design of new services and what you actually do with it when you have it in the first place.
Yeah, that must be key. And I think in health, in the best examples in health, especially in the pandemic, there is this very rapid feedback loop, people coming together daily, weekly to review the patterns, the data, and act. There's a remarkable amount of the health system where that doesn't happen, which is another story, but that has to be the healthy approach. Roseanne and Linda, both hands up, yeah.
Just in response to Marie's point, we've found that you're really learning with these Built for Zero communities that while certain information is needed at the individual level to see that they are well matched and to the right kind of intervention at the right time, but that it's equally important, and this has been the real breakthrough, to have population level data, but really very few data points that everyone who's in that command center is looking at. Who's actively homeless, and then inflow factors, who's new to homelessness that month or that week, who has returned from an experience of having been helped, who's returned from kind of being off the radar and not having been seen in the system for some period of time. And then what's the housing placement rate, and are people exiting the system on their own and at what pace? And also this data is so important to be able to understand the racial disparities and to begin to see where the system is affecting different racial groups differently. And so these really about 6 or 7 data points are the key ones for everybody to share. And only specific actors who are the direct services provider to that individual needs more specific information. But you need both levels. And I think that's one of the things that we've all learned, as you pointed out during COVID, Jeff, that you need those kind of overall patterns, and to have a whole cluster of interrelated, agencies kind of taking action together and seeing and interpreting the situation commonly, and that the more person-specific actionable data can be held at a very different level of privacy.
Yeah. Exactly. And as Mike Foster's put in the chat, I mean, often, you, especially for a topic like homelessness, the qualitative experiential data as well as the quantitative. Linda, then Stephen, please.
And I do want to make sure you had called on Eugene. I didn't want to jump ahead of Eugene if you had anything you wanted to share.
Yeah. Oh, Eugene, you got your hand up. I didn't see that.
He just said, yeah.
That's okay. Everyone just put my hand up. Okay. Again, just picking up on some of the points that's already been raised, really. I think for people in this discussion, we're probably advocates of promoting knowledge and information as power. And we need power to manage situations and deal with situations. I'm not sure how the proactive appetite is in systems. There tied on by responding to crises, the appetite for soaking up knowledge, and it's really about embedding and finding ways to embed the knowledge that we get and the data that we have. I think it's really important to gather data in terms of some of the interventions that are happening. Obviously, in the Wales context, we've got renting homes and an extended commitment to tenants' rights to legislation. So we've got some different variables across the piece. But I think the extension of what data we have through these transitions, gathering it, and how we feed that back into systems. And we have to think proactively to respond to problems, So I think it's key, really. So yeah.
Thank you, Eugene. Linda, back to you, and then Stephen.
Yeah. So two thoughts on this. I think we've got the coalition of the willing going on the phone here around sort of acknowledging the need for this real-time integrated data. Doing it, even when you have willing partners come to the table, the actual doing of it is just so challenging. And so it's about the leadership committing to accessing now the very readily available technology that's a lot cheaper, and the templates that for successful implementation, but getting organizations just to commit to the hard work of figuring out like how to make them all talk to each other and who owns it. You have like just sort of the silos and the egos come creeping back in very quickly. So it is it's not a task for the faint of heart, and so it requires that top level collaborative commitment and leadership to really push it forward. And then the other thing that I think is a really big consideration is it's easy to find solutions where you impose a ton of new data entry obligations on the front line and exacerbate all that frontline issues of workload and burnout. And so finding solutions that actually become easeful tools that can help the frontline workers at the same time do things easier and not just make them kind of the slaves to the data entry is always a huge challenge.
We're nearing the end of our time, and one of the issues on anything to do with data is you've got to make it useful to the people who are providing it. Otherwise, they don't provide it usually, unless they're very coerced. So that's a key thing. I'm going to ask as many of you as possible, especially all our speakers, but to suggest very briefly what might be experiments or actions for the next 6 months, a year. What are the ones we most need to fill in, perhaps that menu of options and evidence that CHI and others work on? If you had a magic wand, what would you be trying out doing quickly? It's one of the things you mentioned, Stephen, earlier on. And just while you think about it, just one quick comment on data. We're doing as IPPO quite a big systematic review on population level mental health. What do we actually learned about how you influence 20-30% of the public, not just 1 or 2%. And it's very striking the imbalances in data between physical health, which actually is remarkably well measured, documented, analyzed, and mental health, which is decades behind in terms of level of organization. But anyway, so it's a slightly different topic, but I think fairly relevant to homelessness. Stephen, over to you.
I'll be very, very brief given the time. Wanted to make 2 pleas and answer your question, Jeff. So my pleas were, one, for everyone to be more symmetric in their approach to data. I often receive reports from centres for data ethics warning me of the dangers of using data. I'd love there to be a centre that focused on the ethics of not using data that would save people's lives. Second, I think data and real-time data, of course, they're important, but picking up on what Mike Foster said in the chat, I think it's really important that we have insight and evidence, not just data. We need to know what works, not just data. And then in terms of gaps, I'd like to feel I mentioned them, better appreciation of stocks and flows. I'd love to be able to model stocks and flows, and a much better appreciation of the interventions of a number of government departments in this space and not just my own.
Thanks, and thanks, Paul, for your comment in the chat about Manchester and what can be done there on data. That's I think will be relevant to lots of people. Lygia, you're going to go?
Yeah, I'm happy to go. And I suppose I'd like to talk a little bit about something we haven't explored very much because of time. It's the fact that it's really hard for people to have the headspace to be creative and to think differently and learn new things, you know. So one of the things that actually needs to happen a lot of the time is helping people do just that. I think sometimes we expect too much of people working on the front line or working in local authorities or working in outreach. People need to be helped to imagine what alternatives might look like. So when you're scoping potential trials, for instance, we see them of being potentially of two types. There's a lot of scope to use behavioral science to improve services that are already there. And people, when we say this, often think that the target would be the people affected by homelessness, when in fact we mean the frontline workers, the workers in Job Centre Plus. You know, how might we apply behavioral science to improve the interactions that often happen between people? And then, of course, there's a lot of scope to do effectiveness trials of different ways of helping people as well. So to give you a few examples, we're
very quickly, because we're almost out of time. Yeah.
Focusing on cash transfers as well as legal aid, all those different ways in which to help people. I suppose in terms of another thing we haven't explored that I'd like to leave with you is how we think that the way that we operate as societies is changing, and that will probably be reflected in homelessness trends as well. So, for instance, rough sleeping tends to be associated with footfall in particular geographies. So it's very likely that as people work in a different way, that rough sleeping will become much more dispersed. And that needs to be thought about as we plan for the next phase. So I'll leave it there, but just some thoughts on the implications for data and culture and the importance of creativity.
Thank you very much. We were almost out of time. If anyone has a one-sentence suggestion on an experiment or a trial, Linda's voted for mental health prevention homelessness, which seems to be a pretty good option. Any other suggestions, Eugene, Marie, in literally one sentence, Marie?
Universal basic income to offset the cost of living crisis.
And if you're interested, we published just a few weeks ago a survey of how to design universal basic income trials. So, as you know, Wales is doing one now on care leavers. Eugene, almost last word to you.
I think the research on care leavers is great. Looking forward to see what happens with that. But I think just research for service users going through the process from renting homes, having an extended tenure, and how that's going to kind of work out in their security and their rights for the long-term accommodation. I think service user evaluations around that would be really interesting.
Brilliant. Look, thank you all so much. We've got a lot of content, I think, in the last 90 minutes, and a fantastic report to help us. My slightly depressing feeling is there is going to be a lot of stress on this field, this sector in the next year or two. So it's really important that we maintain political will, but also wherever possible, the evidence, the examples of the financial savings which can be achieved, as well as improvements in human well-being from getting this right. Do please stay in touch with us. IPPO Cities runs these sessions every few weeks, as does CHI and the rest of IPPO. So if you're not already on relevant newsletters, do please join them. And thank you all, and have a lovely rest of your day. Take care.